Hey everybody, I'm Ryan Clapper. I'm one of our physical therapists out here at D1, and this month we're talking about daily stretches that everybody can do. So if you drive or sit in a car a lot, or you sit at a desk all day, this is going to help you. You can grab onto a railing or a countertop for some kind of support. We're going to stagger our feet here, and we're trying to target the front of this hip. So we're going to do a stretch. I'm going to have you keep your core stable. You're going to slowly start leaning forward, and if you need to hold on, you can. The stretch should be coming on the front of this leg. Ideally, we're going to hold it for at least 30 seconds. We're going to probably do 2 to 3 times, and then you can do this 2 to 3 times a day as well, or as often as you would like.
Hey guys, Carter here, physical therapist out at D1 as well. Going to show you a stretch that you can do daily that can help with tired, cranky shoulders as well as your low back. Okay, so this is going to be for a muscle that we call the latissimus dorsi, otherwise known as the lats. So to set up for this exercise, first, the only piece of equipment that you're going to need is a wall. So back is going to be back to the wall, knees slightly bent and a little bit of ways away. You're going to keep your low back flat on the wall. This is going to help stabilize your spine towards the wall. You're going to do that by trying to contract your abdominals. So if you put your fingers to the side of your body, try and push your abdominals into your fingers. From this position, what we're going to try and do, we're going to keep our elbows parallel and reach them up overhead without allowing our back to come away from the wall. Okay, so to recap, we're going to keep back flat, abdominals engaged. Arms are going to come up overhead without the back coming up. You should feel a real good stretch, real good pull through the side of the body here. Okay? An alternative for this would be if you're laying on your back. Notice how this is a similar position overall. Same thing here. We're going to flatten our back into the table. We're contracting our abdominals. Knees are bent. We're going to bring arms up overhead, keeping them parallel again. You should feel that stretch to the side of your body. You might even feel this in your shoulder or your low back as well. Should be a stretch, no pain involved.
Hello, my name is Chris Riggs. I am the Director of Physical Therapy at Stevens Point Orthopedics. Today I'm going to show you the hamstring stretch. So hamstrings are muscles in the back of the leg. They are tight on a lot of people and they require a lot of stretching. So the easiest way that you can do, sit in a chair, feet flat, one foot on the floor, reach one leg out, lean forward. If you can touch your toe, great. Otherwise, you should feel a pretty big pull in the back of your leg. Hold for about 30 seconds, take a little break, and then repeat. You can do this frequently throughout the day.
Hi, my name is David Hahn. I'm a physical therapist at Stevens Point Orthopedics. Today I'm going to show you a stretch for the muscles on the back of your shoulder. It's a simple stretch for horizontal adduction. The reason we do this stretch is to help patients that are having shoulder pain. If the muscles are too tight in the back, it can cause impingement symptoms in the shoulder, which is a painful tendon pinching sensation.
Hi, I'm Kamara Riggs and I work at Stevens Point Orthopedics. I'm going to be showing you a good and easy posture stretch. You take a bath towel and roll it up, and what you're going to do is come on the ground, have it start right at your low back, all the way up to your neck, so you have a longer one, and you can just lay here. You can move your arms around, and it's a nice static stretch. You can stay here for 2 minutes.
Hi, I'm Dan Burrow. I'm a physical therapist at Stevens Point Orthopedics. I want to show you a stretch that you can do to get ready for a shoulder surgery or to just even loosen up after a shoulder surgery. So I call this stretch the snow angel, and it's kind of an active stretch. So we're going to lay on the floor, arms at your sides, palms up, and all you're going to do is bring your shoulders up. So this stretches the pec muscles. A normal person should be able to go way overhead, but if you've had problems with your shoulders, you might only get to here. What's important is that you stop where you feel like your shoulder needs to stop. You can always work your way up. That's the good thing about this stretch is it gives you some feedback. So as you get better with it, go all the way up, higher and higher each time, until you can go all the way overhead. So this stretch is going to stretch the chest muscles, the pectoral muscles, and get your shoulder ready to do this motion. Good luck.